So today I will be performing an evaluation of the wrist, hand, and fingers. So it begins with palpation. So I'll ask my patient to place their arm out on the table, supinated. And I will start with the carpal bones of the hand. So this is right above the flexor crease in the wrist. You have the scaphoid at the base of the first metacarpal, and that is anatomical snuff box is on the other side of the wrist, but on the palmar side you can palpate right at the base of the first for the scaphoid. Next is the lunate, so if you turn their wrist over and have them flex, the lunate will pop out right here. It's in between the second and third if you line up with the metacarpals. Flipping back over, we have the triquetrum, which lines up with the third and the fourth metacarpal right there, right at the base of the wrist. And then the pisiform is the fourth and the fifth, lines up there. You can feel for it, it's right below the hamate. So if we move up, you can feel the hook of the hamate right there. And then the first one on this side is the trapezium, and you can palpate on either side, palmar or the dorsal aspect. And then you move towards the second metacarpal to get the trapezoid. Capitate is at the third metacarpal. You can do that palmar side. And then the hamate, like I said, is over here. Then after the carpal bones, you have the metacarpals. So those run up into the phalanges, the MCP joint. Those are at the creases of your fingertips, or where your finger begins. So those are the metacarpals. You can 5, 4, 3, 2, and then 1 is at the thumb. And the thumb only has a proximal interphalangeal joint and a distal interphalangeal joint. The rest of the fingers have a proximal, middle, and distal phalangeal joint. Some of the soft tissue palpations, so you have the thenar eminence at the base of the thumb. The middle compartment is in the middle of the hand, and then the hypothenar is the musculature at the base of the pinky. Okay, so that's all for palpations. Next, I will be doing some range of motion. I'll ask them to perform active range of motion. Beginning at the wrist, I will have them do flexion, so bringing it towards your body. Extension is going down. I will have them radially deviate, so that's to the thumb side. Ulnar deviate towards your pinky. And that's all for the wrist range of motion. At the hand, we will be doing, actually we'll just go to fingers. So you can do flexion of your fingers. So that's at the MCP joints. You can do flexion at the PIP joint right there, and then you can do flexion at the DIPs right there. We can do abduction of all the fingers, so spreading them out. Adduction is bringing them in. We can do, with the thumb, flexion and extension of itself. Abduction is away from the body, adduction is towards. Then you can do opposition, so this is bringing your thumb to each individual finger. And that is all the active range of motion for the fingers, wrist, and hand. Next, we'll be running through some special tests for certain pathologies. So I'll begin with valgus and varus stress testing of UCL and RCL ligament of the wrist. So you have them pronated, arm is supported on the table. You will apply a valgus force to stress the UCL. So I'll be stabilizing at the wrist and applying opposite forces here. The varus is doing it the other way. We can also do a valgus and varus stress test at the interphalangeal joints. So you can take one of the fingers, you find those creases, which are a good landmark. You stabilize proximal to that, and then you can apply a force distally. You can do varus as out towards the body, varus, and then valgus is coming towards the midline of the body. Those are the valgus and varus stress testing. Next, we can do Allen's test. So this is a circulation test of the upper extremity. So you will block the radial and ulnar artery. You can hold, it says to hold it for 20 seconds, but you can start to see changes within 10 seconds. You'll notice a discoloration of the hand, and then when you release these pressures, you should see the blood pool back into the hand, and that means that they have good circulation. Next, we can do Tinel sign. So I'll take this little instrument here. It's for testing for carpal tunnel. So you will apply a tap to the carpal tunnel, and this should reproduce symptoms if the test is positive. So they'll have numbness or tingling running into the fingers. After that, we will do the Watson test for scapholunate instability. So you'll have them with their arm flexed. I will apply a force on the scaphoid at the distal end, or at the proximal end, I mean. And then when they're ulnarly deviated, you will move them towards radial deviation. And if the test is positive, you will have some popping or clicking or pain at the site of the scaphoid. The final test that I have is a carpal glide test. So this is done with their arms supported on the table. I will stabilize at the wrist, and I will grasp their carpals in the hand, and I'm gliding up and down, slight movement here. And if the test is positive, there will be increased laxity or possibly some dislocating of the carpal bones. And I think that is all we're going to go through today for this examination.